Thank you. Dr. Beers, thank you for mentioning the environmental influences. Oftentimes, we oversee those or we don't discuss them enough. I happen to represent a district, California's 44th. It includes the Port of Los Angeles. It's surrounded by 3 freeways and the port. And there's high air pollution rates there. These factors, being surrounded by highways, help to contribute to some of the worst air quality in the country. Unfortunately, because of these factors, back home in Los Angeles, asthma is an epidemic. A stunning 1 in 11 children in Los Angeles County have asthma. In my very own district, children walk around with inhalers around their necks. And even the doctor's office, they stock up on boxes and boxes of these asthma inhalers, expecting to see children come in. It is so heartbreaking to see, and which is one of the reasons why I'm so happy that we are trying to move legislation to address this, although there is a lot of steps that need to be taken. The rates of asthma in communities of color are even worse. That's my very district. I have a district that's almost 90% Latino, African American. Some of the statistics say that 25% of African American children in LA County have asthma, and Hispanic children are 1.5 times more likely to die due to asthma when compared with other non-Hispanic children. Statistics such as these are one of the reasons that I am a co-sponsor of the School-Based Allergies and Asthma Management Program. By incentivizing schools to maintain asthma management programs, students and parents can be assured that the child will be able to have the care they require in case of an emergency. Mr. Mendez, can you elaborate a little bit on how this bill, H.R. 2468, will help to reduce some of the racial disparities that we see happening with asthma?
Yeah, sure. I mean, you know, there's going to be a child with asthma or allergies in just about every school in the United States. So to the extent that this program creates incentives to have an asthma or an allergy action plan in the state, will be really helpful to all those communities. The CDC, which provides grants and works with the public health systems in each state, will favor whatever schools or whatever states have this kind of program. So to the extent that this becomes legislation, it creates incentives for schools and states to do this, then it'll improve funding and their likelihood for getting funding to prevent asthma and allergy attacks and have the right systems in place.
When I was a kid, I remember my father had a home that was right near the freeway, and I didn't know any better. I said, well, geez, if you live near the freeway, that must mean it's going to be faster to get to where you want, so it's a great place. And of course, now knowing what I know and the allergies that I deal with, I know that there is a connection there. Besides this bill, do you have any ideas on other things that we could be doing to address asthma, you know, in particular on a congressional level?
Sure. I mean, you know, there's the outdoor environmental issues as well. I mean, to the extent that there have been rollbacks of some legislation that, you know, have contributed to more dirty air. I mean, that's certainly an area you're witnessing it in your district. And I think in particular, they're trying to come up with specific standards for truck truck emissions. And in particular, if you're in that window of that area where I think it's the port, there's quite a bit of short-haul trucking, and there's quite a bit of pollution that's generated from that. So there's the outdoor environmental issue, and then, you know, there's the indoor environmental issues as well. Having, you know, indoor air quality and being aware of that in the schools. I mean, kids spend the majority of their time either at school or at home. Those are areas that we could really be focusing on.
Great, thank you. And ladies, thank you for being here to talk about the infant mortality rates. Certainly in a community like mine, that's a minority, it's heavily impacted. In LA County, they've received over $1 million that we're able to invest in programs such as the Mama's Neighborhood Project, which provides tailored home visits during prenatal labor, delivery, postpartum, and interconception periods up to 18 months following birth. These visits help reduce the rates of infant mortality. With the last 10 seconds I have, do either one of you, can maybe you comment on how else the Healthy Start program worked to reduce the racial disparity? How
I'll give a 2-second answer, which is I think that engagement with the community and the focus on community impact and collective impact is a really important component of it, so that we're co-designing solutions together with families and communities who are most impacted.